Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. So in this video, I want to talk to you briefly about health disparities in healthcare and just how COVID-19 has exposed that. So if this is your first time to my channel, this channel is it's about giving tips on health. I post a video once a week, minimum, about anything in the news regarding healthcare. We can have a conversation about that, have a discussion about that. In addition, I give tips, for nursing students on how they can prepare to take their exams and do better. So again, for this, I'll talk about health disparities. I also use the word pre-conference for some topics. Pre-conference is the conversation that nurse instructor may have with their aide students prior to going into the clinical setting to give care and learn. So with regard to health disparities, what COVID-19 did was expose what's common in many societies. Healthcare, access to health isn't equal, and it's not just based on race. And I ask everyone to be mindful, when we have these conversations, it's not always related to race. However, race many times will bring to the forefront things that happen in society. So recently, both Dr. Fauci and the Surgeon General, they mentioned that a large number of African Americans have been affected by COVID-19 and dying, disproportionate to the percentage of those in their states. So let's talk about that briefly. So what are health disparities? So health disparities are the things that make your health different than someone else. It could be access to health care, your perception of what health is, insurance, gender, previous conditions. So with regard to the African American community and why it seems that they're at a higher percentage, is because what we know about COVID-19 and the population and the people that it likes to affect. So individuals with an underlying heart disease, well, hypertension runs rampant in the African American community, and hypertension can contribute to further heart disease. Diabetes, I think diabetes runs in every population. But in this conversation about health disparities, I think we should also talk about what are the social determinants of health. And the social determinants of health are stuff such as your income. If you're lower income, and African Americans in the United States proportionately less lower income, more on minimum wage, more on welfare. Now, not all African Americans are on welfare or poor or lack of access, but those are some of the health disparities. So if you're watching this video and you're like, well, I'm not African American, not everybody can be. Look in your community. What in your community puts you at risk? Do you have health insurance? If you have no insurance, regardless of your race, you have a health disparity. Are you older? If your family member is 65 and older, is an older adult, it puts you at greater risk for complications such as pneumonia, the flu. Much older also puts you at risk for secondary diabetes, secondary hypertension. You may or may not have any risk factors of it before, but as you get older, and some of the normal changes in your health, kidney, decreased filtering, liver, decreased metabolism, bowels, slower motility. These are some of the risks that puts you at risk. Your fat distribution is different, so you now hold on to weight despite the fact that you're eating the same thing, same amount of calories, number of calories rather. So, let's not focus this topic just simply on race, but just health disparities. I choose to not put this focus solely on race because health disparities, it's not solely related to race. Regardless of your race, if you're unemployed, that's a social determinant that may affect your health. If you're unemployed, chances are you don't have health insurance, or then you may have to apply to some government agency to apply for some assistance such as Medicaid. And those of us in the healthcare system understand that not all physicians want to take Medicaid, a state-funded insurance, because the reimbursement is so poor. But Medicaid is an insurance that can assist individuals with either lack of finances or a disability. So the health disparities must be addressed. What can we do? What can you do as a nursing student when you're doing that long health assessment and it comes to the insurance part and it comes to who they live with? Really spend some time to look at that. If it's an individual who works, I don't know, I'll pick a you work as a waitress. Now, waitress, it's hit or miss. I believe they get a small hourly pay, but most of their pay is based on tips. Now, imagine a time such as now, how COVID-19 has caused so many places, such as restaurants, to close. Those individuals, waitresses and bartenders, they're not making any money. These are now vulnerable populations, regardless of their race or ethnicity. These are the social determinants of health. Economic disparity is a social determinant of health. Of course, if you have if you have a known profession, and by the professions that require a college education, such as a registered nurse, a physician, an accountant, an attorney, the likelihood that these individuals will survive this crisis is good. I mean, especially if you're in healthcare right now, they're willing to pay you money. You pay you money on one end, but jeopardizing your life on the other end, caring for individuals with COVID-19. So, these are some of the health disparities and the social determinants of health. So again, the average nurse, you're not a social worker, so you don't know everything about access to finances and who qualifies for Medicaid. I think what we can do, we can recognize what we lack. Recognize that this situation requires somebody else's expertise. A social worker is an amazing person as part of the healthcare team. They can assist that person getting transportation home, access to a rehab, get them referred to a rehab, find resources in the community that the average nurse may not know. So I think we need to look at this as a team. And, COVID-19, I call it's a litmus test. COVID-19 is a litmus test to test who is more at risk for health issues. And once this pandemic is over, and please, I hope it's over soon, we're still going to have those same health disparities. The individuals that had poor access to health, poor nutrition, no income, low income, those things are still going to be there and need to be addressed. So as a member of the healthcare team, it is our responsibility as caring, compassionate human beings to really understand that the health disparities exist. It's not solely on race. We must try to help individuals along the continuum of health. Of course, if you can join a gym, I have a membership to a gym. It's closed right now, but what about the mindset? So just because the gym is closed, you don't exercise? No, there's YouTube. You can exercise in your house. I did Zumba yesterday. It's not the same for me. But again, we need to change a mindset. You don't have to join a gym in order to do physical activity. You can walk. So some of the health disparities and some of our social determinants could also be our thinking. Ladies and gentlemen, as you go through the day today, I want you to be grateful for what you have. Be grateful for your access. Just recognize that, for some it's not equal, and in any way that we can help one another, we should do that. And I think I'll end here. And, as always, I want to thank those of us who have joined my channel. Again, I try to do a video once a week at minimum about current events in health and also some tips for nursing students. So if this is your first time to my channel, welcome. I hope you stay. Have a good day.